Hello friends, welcome to Conceptual Surgery. Today we'll be discussing a topic which is not considered very important for the main curriculum, but in today's world, I think it is a very important topic to know about and to be an effective player in today's world as a surgeon, as a human being. And the topic is disaster management. In this topic, we will try to understand few terminologies which are used in disaster management cycle, how they are, what is our role in various phases of disaster, and after that. So let's start. So disaster and emergency are two words which are used sometimes interchangeably, but they are very different. And let's try to understand what is the difference. Now, disaster is a condition which is when the demand of the existing situation is overwhelming and it is much above the existing facilities or resources available. So when the demand of a situation, which can be let's say an earthquake, an accident, a flood, train accident, aircraft crash, when it exceeds the available resources in that area, then this situation is called disaster. Whereas if the existing resources of that area we are able to manage the situation by that, it is known as emergency. So as per definition, a serious disruption of the functioning of a community causing widespread human, material or environmental loss which exceeds the ability of the affected community to cope using its own resources, and that's why they will need an external support. So two things are important. It should exceed the ability of the local community and the resources, and that's why they would need an external help or support. Then it is termed as disasters. We would often hear that after a situation, it is declared as a state disaster, but not a national disaster. It is sometimes declared as a local disaster, but not a state level disaster. So like, for example, there's a train accident which involves, let's say, 100 injured patients, and there's a local hospital which is pretty big. Let's say it's a 2,000 bedded tertiary care hospital which is nearby. It is maybe a not disaster because that hospital in itself will be able to handle that load of patients. But if the same accident, let's say, happens in a remote area where there's just a small hospital in the site nearby, which, let's say, maybe have 5 beds. Now, for them, tackling 100 patients is not possible. So they would need an external help in form of doctors, beds, medicines, and supplies. So that will be a disaster for that. When Uttarakhand flood happened a few years back, it was a state disaster, but it was not declared as a national disaster because India, maybe as a country, was able to handle the load of it, but as a state, Uttarakhand was not able to handle it. So that is the difference between disaster and emergency. Emergency can be a small accident, can be equipment, but it is in relation to the available resources. So that is how. So you can think of various situations where it will be a disaster for some areas, but not for maybe your hospital or where you are working. So let's say you're working in a big hospital, there's a bus accident in front of that hospital. Now that hospital is a big hospital. Number of patients out of that bus accident is, let's say, 20. So it may be not a disaster, but if the same thing happens in a village, it will be a disaster. So if you see these pictures and think, what are these? These are disasters or emergency. I think this one is clear. This is a flood which is affecting many houses and widespread area. A lot of people would be involved. They will be displaced. The needs which will have food and medicines and shelter for all these people. I think local community might not be able to fulfill this. So this will be a disaster. A car crash involving 3 cars. Looks like 2-seaters, so 5 to 6 maybe injured people in this. Maybe an emergency, not a disaster. Again, an earthquake situation, lot of buildings collapsed, lot of structural damage. Again, would most probably be a disaster. A train accident, again, will depend on what area it is. It is near a city or in a remote area. Looks like there's a city right behind, so maybe an emergency. So this is a difference between disaster and emergency. Now, another two terminologies which come are hazard and vulnerability. So let's try to understand with using this example of a cartoon. So if you see here, there's a rock which is going to fall on this person. So this mountain height, this rock, is all an hazard. Now, if somebody is standing under that mountain or that rock, that means that person is vulnerable to this disaster or this natural calamity. So this person will be labeled as vulnerability. Now we'll be using similar cartoons to understand various terminologies. Okay, so this is the hazard and vulnerability. We use a lot these days that what are hazards and what are vulnerability. Now anything which has a potential to injure or to harm you is a hazard. So like during earthquake, lift can be a hazard, which is very important utility for us. But during earthquakes, during power, it can be a hazard. During fire, it can be a hazard. During floods, electricity can be a hazard. So you have to understand hazard can be anything which may cause harm to us. And if we are exposed to that hazard, we are vulnerable, and that is called vulnerability. Now, hazard can be anything. It can be a natural thing. It can be like a volcano. It can be like an ocean. It can be forest fire. So very normal looking things at one time can become a hazard in like a matter of seconds sometimes. So which has a potential to cause injury or damage property and environment is all hazard.